Bacterial diseases refers to a large variety of diseases caused by bacteria or bacterial components. Bacteria are transmitted to humans through air, water, food, or living vectors. The principal mode of transmission of bacterial infection are contact, airborne, droplets, vector, and vehicular. Some of the diseases are explained here, that is tuberculosis, pneumonia, and cholera. Tuberculosis is a contagious infection caused by Mycobacterium tuberculosis, a type of bacteria that attacks the lungs and spread to other parts of the body like brain and spine. Tuberculosis is divided into two types, that is latent tuberculosis and active tuberculosis. In latent tuberculosis, the TB bacteria enters the body through respiratory tract. This type of TB doesn't express any symptoms and it's not contagious. This infection causing bacteria is still alive and one day it may become active. The active Mycobacterium tuberculosis can cause infection which is contagious and can be spread to others. 90% of active cases in adults come from a latent tuberculosis infection. Tuberculosis is transmitted through cough, sneeze, talk, laugh that releases tiny droplets that contains the germs. TB spreads to a person who is spending long time around someone whose lung is severely infected with the bacteria like co-workers, friends and family members. Signs and symptoms of active tuberculosis are coughing up blood, chest pain, unintentional weight loss, fatigue, fever, night sweats, and loss of appetite risk. Risk factors of tuberculosis includes HIV, diabetes, severe kidney disease, cancer treatment such as chemotherapy, drugs to prevent rejection of organ transplant, and also IV drugs or excessive alcohol use weakens the immune system and makes the person more vulnerable to tuberculosis. Tobacco use greatly increases the risk of getting TB and dying of it. Regular contact with people who are ill increases the chance of exposure to TB bacteria. Tuberculosis infection can cause complications such as joint damage, lung damage, infection or damage of bones, spinal cord, brain or lymph nodes, liver or kidney problems, inflammation of tissues around the heart. Diagnosis and treatment of tuberculosis include blood test, imaging test and sputum test. Blood test. Blood test can confirm or rule out latent or active tuberculosis. Imaging test. A chest X-ray or a CT scan might show white spot in the lungs where immune system has walled off TB bacteria, or it might reveal changes in the lungs caused by active tuberculosis. Sputum test. This helps for the doctor choose medications that are most likely to work. Tuberculosis vaccine is commonly known as BCG vaccine. Children in countries where TB is common often get the BCG vaccine. TB can be prevented by good ventilation, natural light, and good hygiene. Pneumonia. Pneumonia is an infection that inflames the air sacs in one or both the lungs. Bacterial pneumonia is an infection of the lungs caused by certain bacteria. The most common one is Streptococcus pneumococcus, but other bacteria can cause it too. Pneumonia can be transmitted through cough, sneeze, and contamination on objects. Practicing good hygiene can help prevent the spread of pneumonia or the risk of catching it. Signs and symptoms of pneumonia vary from mild to severe. Cough, fatigue, fever, lower than normal body temperature, nausea, vomiting or diarrhea, and shortness of breath. Risk factors: children of age 2 or below and adults of age 65 or above, all at high risk of getting pneumonia. Greater risk of pneumonia is in hospital intensive care unit, especially with the use of ventilator. Patients with asthma, chronic obstructive pulmonary diseases, or heart disease are more prone to pneumonia. Smoking damages the body's natural defenses against the bacteria and viruses that cause pneumonia. People infected with HIV, had an organ transplant, or received chemotherapy or long-term steroids are at higher risk. Complications: bacteria that enter the bloodstream from your lungs can spread the infection to other organs, potentially causing organ failure. Breathing difficulty: because of the pneumonia, breathing trouble will occur. Diagnosis: pneumonia can be diagnosed with a chest X-ray and the amount of oxygen in blood using the pulse oximeter. Treatment for bacterial pneumonia. Bacterial pneumonia is usually treated with antibiotics. The specific antibiotic choice depends on the factors such as general health, other health conditions, the type of medication, and recent use of antibiotics. There are two pneumonia vaccines available, namely Pneumovax 23 and Prevnar 13. Prevention: washing hands regularly, especially after using the toilet and before eating. Eating balanced diet, exercise regularly, have a proper sleep, avoiding bad habits such as smoking, staying away from sick people. Cholera is an infectious disease that causes severe watery diarrhea which can lead to dehydration and even death if untreated. It is caused by eating food or drinking water contaminated with a bacteria called Vibrio cholerae. Cholera can be transmitted through contaminated water or food. Sudden large outbreaks are usually caused by a contaminated water supply. Outbreaks and endemic and sporadic cases are often attributed to raw or undercooked seafood. Direct person-to-person transmission is rare. Signs and symptoms of cholera include severe watery diarrhea, vomiting, rapid heart rate, and loss of skin elasticity, dry mucous membrane, low blood pressure, thirst, and muscle cramps. Risk factors: poor sanitary conditions, reduced stomach acid, household exposure, type 4 blood, raw or undercooked shellfish. Complications: hypoglycemia. Dangerously low levels of blood sugar can occur when people become too ill to eat. Low potassium levels. People with cholera lose large quantities of minerals including potassium in their stools. Kidney failure. When the kidneys lose their filtering ability, excess amount of fluids, some electrolytes and waste build up in the body. Diagnosis and treatment. The only way to confirm a diagnosis is to identify the bacteria in the stool sample. Quick confirmation helps to decrease the death rates. Replacing the fluids and electrolyte in the body using a simple rehydration solution, that is oral rehydration salts. Intravenous fluids. Most people with cholera can be helped by oral rehydration alone, but severely dehydrated people might also need intravenous fluid. Some antibiotics can reduce diarrhea that is related to cholera. Research has shown that zinc might decrease the diarrhea related to cholera. Cholera vaccine is used for active immunization against the cholera. There are 3 oral vaccines available, that is Dukoral, Shankol and Uvicol. Prevention: wash hands with soap and water frequently, drink only boiled water, eat only completely cooked food. So in this video we learnt about tuberculosis, pneumonia and cholera.